Hello, my name is Danielle Campbell and I'm an ASHA certified speech and language pathologist. For the past 10 years, I have been providing speech, language, and voice therapy to both children and adults. Today, I would like to talk with you about the basics of pediatric voice therapy, as well as give you a few strategies that you can use at home. Before we begin, I would like to say that if anyone is experiencing a hoarse vocal quality persistent for more than 2 weeks, it is recommended that you reach out to an otolaryngologist or an ears, nose, and throat doctor. Because voice therapy may be contraindicated for some patients, it is recommended that you only use these strategies as a form of a guide until you meet with a SLP. This video is not meant to be a replacement for direct voice therapy treatment. Vocal hyperfunction can occur at any age. However, it is the most common cause of pediatric voice disorders. As a parent, you may notice that your child has a hoarse-sounding voice. This may be due to vocal nodules or some other hyperactive vocal disorder. The ENT can help assess and determine the underlying cause of the hoarse voice.
Rub-a-dub-dub, free in the tub. Rub-a-dub-dub, free in the tub.
A few strategies that you can use to encourage your child to have healthy vocal hygiene are listed and discussed next in this video. The first strategy is to use vocal rest. For every 20 minutes of speaking, it is recommended that you encourage your child to have 5 minutes of vocal rest. You can do this by setting a timer to help them understand the concept of 5 minutes, and you can also encourage them to engage in some quiet activities. A few ideas for you could be the use of Play-Doh, puzzles, listening to a story or an audiobook, as well as taking a quiet nature walk. You might use a sticker or a reward chart to help track your child's progress so that they can visually see that they are giving their voice a chance to rest and heal. The next strategy is to avoid yelling, screaming, and shouting. These vocal behaviors can cause further irritation at the level of the vocal cords. If your child is on an organized sports team, you may want to let their coach know that your son or daughter is working on reducing their screaming, yelling, and shouting. You could also encourage your child to use clapping, high fives, or whistle instead of shouting, screaming, or yelling. The third strategy is to increase overall hydration. You may want to again use a different type of sticker or a reward chart to track your child's water intake throughout the day. Also, it is best to limit caffeine as well as sodas, as this can cause further irritation on the vocal cords. You could also consider placing a humidifier in your child's bedroom. If you notice that your son or daughter often clears their throat like this, you may want to help encourage them to take a hard swallow instead of clearing their voice. This can help reduce the amount of times that the vocal cords are colliding and causing irritation. As your child is learning to become a better communicator, help encourage him or her to become a better listener. In turn, this can help your child reduce the amount of time that he or she is talking. Encourage your child to ask questions and then listen to the speaker as they go about the conversation. In addition to the previously mentioned vocal hygiene strategies, you can also encourage your child to use diaphragmatic breathing. Oftentimes, we will use short, shallow breaths, mostly up in the clavicle region. However, to have a good, strong voice, we want to engage our diaphragm. Have your child lie down on the floor and tell him or her to place his hand over his belly. As you are having them lie on the ground, ask them to inhale for 2 to 3 counts through their nose. And then on the exhale, tell them to blow out birthday candles for 5 to 6 counts. By placing the hand on the belly, your child will help have a tactile response to taking in enough air through their stomach and expanding it, and then having the air decrease and the hand go down on the exhale. Try to encourage your child to practice diaphragmatic breathing a few times a day. You can ask them to try it about 3 times a day for 5 minutes each. As I previously mentioned, a formal speech and language assessment and evaluation of the voice is necessary prior to beginning and engaging in any direct vocal exercises. Your son or daughter's speech language therapist may offer different strategies. I am going to go over 3 different vocal exercises that may be advised in your son or daughter's plan of treatment. The first activity may involve the use of a straw, cup, and some water. What they will ask you to do is to first blow air into the straw like this, and then add voicing. So you would take a breath in, blow air out, and then add the voice. You will know this is working if you can feel air coming out of the bottom of the straw, as well as hearing the sound. You can also have your child practice doing cup bubbles. So fill the glass of water up and place the straw into the water, and as you would suspect, ask them to blow bubbles into the cup of water. You can have them also practice add voicing again. Another vocal exercise that the SLP may assign to your son or daughter is to do tongue trills. This will help to release overall tension. What you can do is to ask your child to trill their tongue going up the scale and down the scale. It will sound something like this. Another direct vocal exercise may be engaging in the use of the resonant voice. To do this, you will practice humming in isolation. However, when making the hum sound, try to blow the air out towards the front of the face, near the cheeks. It will sound something like this. Hmm. Hmm. As your child progresses within therapy, a hierarchy of words and then phrases will be added so that the resonant voice is used, as this is a healthier vocal quality. In conclusion, there are many things that you can do to help modify your child's environment to help them practice healthy vocal hygiene and thus reduce vocal misuse. The SLP will also potentially assign a series of vocal exercises to be done throughout the day. The combination of these two tasks, both indirect and direct vocal treatment, will help to improve the overall quality of voice and reduce the hoarse quality, as well as help to decrease the vocal nodules. If you have any further questions, please reach out to a licensed ENT and SLP within your area. To find a provider for a certified speech-language pathologist, go to the website www.asha.org. This is the American Speech Language and Hearing Association's national website. There, you can plug in your zip code and find a certified provider within your area. Thank you.